When I graduated NC State, I moved to Chapel Hill with my husband because he was going to law school. And at first, I just kind of was like, I need to find a job. So I took like the first one I could find related to food in the area. So I worked at Southern Season for 3 months. Quickly discovered I was not good at retail. So I found another position with a small business in Chapel Hill called Clinical Tools. And I was a research assistant for them. So I started off not doing a whole lot with nutrition, but it was really cool because it gave me a really broad background, especially with like computer design and web development. But I was still in the public health field. And then I was there for about 2 years, and then I found this position advertised for a project manager at UNC, and I was like, well, I have all these skills, I'm definitely going to apply for it, and a few months later I got it. So as a project manager, I keep track of our timeline. Are we on track with our milestones, our goals for the grant? The grant is called Healthy Me, Healthy We. So we've designed a social marketing campaign where we have targeted messages about health that are in different formats. It's all preschools in North Carolina, and we aren't trying to focus on any particular type of preschool. We're doing Head Start, Smart Start, private, public, religious. It doesn't matter to us. We want this program to be able to function in any type of center. Children hear different messages from the preschool teachers than what they hear at home. So we want to give parents and teachers tools that kind of make the messages the same and cohesive. So like we have the posters here, which you can see repeated are these messages: enjoy active play every day, take out your active toys, and H2O is the way to go. So we have them on posters that will be in the classroom at the center. Then we have the Family Guide magazine, which goes home to parents, and it also has these similar messages as well as home activities and articles for parents to read about nutrition and physical activity. And then for the children, we have these trading cards, which go home with them, that have the same message for each unit and a fun picture. And we write like the letter A for the activity that matches up to the activity in the Family Guide. So you can kind of see in here we have activity A. And so that just prompts the parents at home to complete the activity. When I first started, it was a couple weeks of just learning what the heck is this grant about, what are we doing, learning kind of what my role was on the project and learning the other staff. And then we jumped right into formative work on the grant, so doing focus groups with parents and providers and figuring out what they wanted in a program related to preschool nutrition and physical activity. So I was out assigning people to go recruit parents and providers, keeping track of where these focus groups were going to be held, and each week we had a meeting with the principal investigator and co-investigators and just keeping them up to date on what was going on. And then, of course, submitting IRB applications, consent forms, designing recruitment materials, working with our interventionist, the woman who designed all these materials, and making sure that she had what she needed to get her job done. And then this past May, it was like a crazy rush to hire all of these new staffers to help us with data collection. So I spent probably the month of May in interviews with tons of people because we needed to hire at least 16 staff members. And then from there we started center recruitment, so training those people to go out to centers and talking with center directors to figure out, are you interested in signing up? And then training another set of staff to do parent recruitment, scheduling people to go out into the field, logistics, keeping track of data coming in and information going out. And then at the end of July, it turned into something completely different where we were actually out data collecting at the centers that we recruited. So basically it was tied to my cell phone for the past 8 weeks with data collectors calling me and asking, what do we do in this situation? What do we do in this situation? I need this information. At the beginning, before the program starts in the center, we take our baseline measures, which are, we get a 3-day food diary about what the children eat at home. We do what's called DOC. It's an observation of what the children eat at the child care center. So we have research staff that go out to the center and observe what the children eat, what they're served, and then the amount remaining. And then we have a center here at UNC called the Nutrition EpiCore, and they combine the food diary data with the doc data and tell us what the children ate, what their food looks like for 3 days using NDSR and comparing it to the Healthy Eating Index. And then the children will wear an accelerometer, which is sort of like a pedometer, for 7 days. And then we have a series of surveys that the parents, the teachers, and the center directors all fill out about their health, nutrition, and physical activity. So we do that at the beginning of the program, and then at the end to kind of compare if there was any effect, good or bad. With these intervention materials, a lot of them are related to nutrition, so I get to kind of give my 2 cents about, in my experience when I was in undergrad research and preschool centers, this is what I saw, and this is how I think it could play a part. When I was in my undergraduate research at NC State was very similar to this. I worked with Virginia Caraway Stage, and she was creating a curriculum for preschool children to improve their nutrition. And so we created the lessons together, and then we went out to the center and actually taught them ourselves. So it gave me an understanding of how childcare works and understanding what goes on in the childcare setting and kind of what ideals are there and what's not so great and where things can be improved. And also just a general understanding of how research works, like why we get consent and what that means. My advice to current nutrition students is to get a really broad base of education, learn about different things. When I started as a research assistant with clinical tools, I had to start learning coding. I learned HTML and CSS and a little bit of jQuery. And I think that was one thing that when I got this job, they were really excited about, that I had even though it was a small amount, it was web development, and it wasn't just all of my background was nutrition and that was it. It was broad. I would say don't limit yourself. Apply for jobs you don't think you can get or you don't think you're qualified for. Even if it's not nutrition specific, just getting skills in a certain area, you can always come back to nutrition.